Hi everyone, we're back, and today we're talking about balancing your hormones. And I'm really delighted to have with us Dr. Jim Mirabile. Dr. Mirabile has been my personal doctor for 12 years for bioidentical hormones. And my personal journey was that, if you recall, Dr. Mirabile, I couldn't sleep. I was really fortunate through the change of life that I didn't struggle with so many other things that women struggle with, but I just couldn't sleep. And it really started to have a big impact on my life. A friend was kind enough to share your name with me, and I came in to see you, and you kind of rescued me. And very, very quickly, within literally weeks of starting on the bioidentical hormones, my sleep has never been better. And I've never had to take sleeping pills or any of that. But with that, welcome.
Thank you very much, and thank you for having me here, because this is this is a huge interest of mine in how we can educate women on the benefits of hormones. And that's what's important. If we can give them the hormones when they need them along the way, we can prevent inflammation, we can prevent disease. And that's why I think this is an exciting topic to talk about. You've been through it. You know, the number one hormonal deficiency in the world is menopause. If you live long enough, you're going to get there.
Yeah.
So, but it's not old. The average age of menopause, Laura, in North America is 51.5 years.
Wow.
All right. How many women do we know that their life is just getting started? Yeah. Go back to my mom's generation. At 50, they got old.
Yes.
This generation's not old at 50, but they want to look good. They want to feel good.
Yeah.
And balancing hormones and changing lifestyles is so important.
100%. You have an incredible background. Would you just take a moment to tell us about your background?
Sure. I'm from Kansas City. I board certified OBGYN. For whatever reason, I was raised with 4 boys, and I decided to go into OBGYN. And it's been a wonderful, wonderful vocation. I got board certified. I delivered over 7,500 babies
Wow.
in the first 15 years of my practice.
Yeah.
But I also realized during that time of this need of women that were maturing as my practice matured, and they were having problems. And we are not taught about hormones in medical school. We're not taught about hormones in residency. So we're taught how to deliver babies.
Yeah.
But when it comes to a mature woman that has problems, we're not taught that. Yeah. So when I stopped delivering babies, I found ways to learn more. I had a mentor, Gino Titera. Dr. Titera founded the pellet. And so I learned about that through him and got more into the hormones. Stopped obstetrics, and at the same time, I have a full-time medical spa in the practice where we do all kinds of non-invasive cosmetics. So
you're being very modest. I know that you have the most successful practice in the greater Kansas City area for beauty, health, and wellness. It's an incredible practice, and you're much loved and respected, and you make many of us feel much better about ourselves, and I'm grateful to you for that.
Well, I think it's important, Laura. You know, as a doctor, we're taught, here is a disease, here's how to fix it.
Yeah.
We're not taught how to prevent this disease.
Exactly.
All right. And that's where our healthcare should be at, because we're in trouble with healthcare in the future.
Absolutely.
So we need to start taking care of ourselves, because it may not be there for us in the end.
Yeah, it's so true. And we talk a lot about chronic inflammation in this series, right? That's what it's all about. And we know that chronic inflammation starts with certain things in the body that just kind of go wrong, and it spins out of control. In hormones, tell us about how do hormones, balancing our hormones, how does that affect our health?
Well, if you look at our hormones, if you want to take just our female and male hormones, okay, unfortunately, we've gendered those terms into male hormones and female hormones, despite the fact that both of us make both of those hormones. Yeah. So, but anytime you have a disruption in the balance of those hormones, when you're young and you have a imbalance, you'll have abnormal bleeding. You might have other problems associated with that. But as a woman matures and as estrogen decreases, as progesterone decreases, and as testosterone decreases, that's where we see the changes in the body. That's where we see inflammation. That's where we see things going wrong. That's where we're not interrupting and saying, let's talk hormones. We're giving them patches, and that's not what we're supposed to be doing.
So talk to us about bioidentical hormones. What are those and why are they helpful to women who are going through a change of life?
People have discredited the term bioidentical hormones for years. Basically, under a microscope, they are the identical hormones. They're plant products, but they have the same chemical structure that your body has made all your life. All we are doing is replacing that. It has to be done correctly. It's not some, where you drive by and get a shot, or you get this and you don't monitor it, then we get in trouble.
Yeah.
But monitoring of the hormones is definitely a very important process in taking care of women while you're treating them with hormone therapy.
Yeah. And when our hormones get out of whack, sometimes we can put on weight. So, and this is obviously one of the things that happens, not just in midlife, but it can happen in all age groups. Can you talk about that?
Sure. As our estrogen it decreases, let's take women and take estrogen decreases. Estrogen is responsible for fat distribution. We get inflammation in those fat cells, then we have cortisol kick in. Okay, we have more inflammation. Wow. Now we have a body full of inflammation. We have patients coming in going, my cortisol's high, check my cortisol. Well, what do you want me to do about your cortisol? There's not a magic pill for that other than lifestyle changes, balance your hormones, proper diet, exercise, control stress. That's how we treat this. We also have to fill in the blanks with the hormone therapy, and that's where the bioidenticals come in. I use bioidenticals throughout a woman's life. Somebody might come in, they're 25 years old, and they're lacking testosterone. Testosterone is a big topic today, and it's a missing ingredient in women as they mature. We don't even know what's natural or what's normal for a woman. We want a woman to be about 10% of a male to prevent any side effects. So we can replenish them with that testosterone. More often, we see this in perimenopause, where progesterone, which is your natural anti-anxiety, relaxation, sleep hormone, as that starts going out in the late 30s and early 40s, more irritability, sleepless nights, the testosterone at the same time is low, so we have no libido, we run into more social problems with that. Physically, the inflammation that is caused by that causes disease, and that's where we end up with a big problem when we change of life, that transition.
Yeah. Who's the ideal candidate for bioidentical hormones?
Basically, anybody is a candidate. They've been making hormones their whole life. There are certain patients that cannot use hormones. Somebody that has an estrogen-dependent cancer, we don't want to feed that. Someone with a history of blood clots, we don't want to give them to. But there are alternative treatments that we can utilize. I'm still, when I do have patients use alternative products, I want to see those. I want to see what they're buying over the counter, making sure it's something safe, because you really don't know what you're getting unless it's, from somebody who knows what they're doing. So I think that's important.
To be clear, you would not advise that people go into a pharmacy or a health food store and buy something off the shelf, because they could actually cause themselves some harm when it comes to hormones, correct?
Laura, absolutely, because you don't know what you're getting.
Yeah.
Seek out a professional that specializes, whether it's your OBGYN, your family practitioner, your nurse practitioner, talk to them about hormones.
Yeah.
Talk to them, and you may find them against hormones because of a study that was done 21 years ago where there was a lot of bias. So we still have physicians taking our patients off of hormone therapy.
Now, if I'm not mistaken, was that the study that was actually done on HRT?
Correct.
It was actually hormone replacement therapy. And if I'm not mistaken, that that drug, which was actually made by Wyatt and patented, that was, tell me if this is incorrect, the base of that drug is made from the urine of a female horse.
That's where it gets its name from, pregnant mare's urine, Premarin.
Wow.
That's where it's from. If you took that pill and you put it in a glass of water right now, by the end of this talk, it'll smell.
So truly, that is such a different medication.
Correct.
Than the bioidentical hormone, because what you said at the opening, the bioidentical hormones, our body recognizes that because it's made from, it's plant-based, it's made from the same elements that our body recognizes, so our body can metastasize it, where the HRT, which, you know, here's another interesting thing that I remember from way back then, that study, it was a huge study. And as a result of that study, the FDA took that Wyatt drug off the market. And
Actually, it still is on the market.
they brought it back.
They brought it
because
back.
there was so much outcry. People wanted it. They didn't know about bioidentical hormones. That was such a new thing back then. And yet, women wanted that drug because without having the hormones, they were losing their minds. You know, some women have a terrible experience through change of life. And so, you know, I just feel so badly for those women that didn't have access
I'll
to
never forget
bioidentical.
that day. I woke up in the newspaper. There was a headline on the front page of the newspaper about the WHI study called the Women's Health Initiative,
Yes.
stating that we were causing breast cancer, we were causing heart disease, we were causing all kinds of problems. Well, what is somebody going to do? They cold turkey. Within 3 months, Laura, people were banging on the door wanting their hormones back. They didn't care. They needed to feel good.
Yeah.
You know, you're talking about a time of life where a woman is going through psychological, physical, it's a transition.
Totally.
And when you take away the ingredients that make them who they are, they become very indifferent. They become depressed.
Inflammation explodes.
It's all about the inflammation, and it's the first response of the body being injured.
Yes, absolutely. Well, let's shift gears and talk about the guys, because equal time for the guys. So I know you also work with men, and there are things that men can do as well, because men also can go through, it's probably not talked about as much, but men definitely go through times where their hormones change.
Correct.
And how do you address that? Who is the candidate for that?
Well, you know, I'll tell you a real funny story. Taking care of women, I'm a board certified OBGYN, not dealing with men, and then getting into the hormone therapy and helping women improve their lives. Women would come in and they'd go, will you see my husband? He's got this problem. It's like, no, I'm an OBGYN. Well, my husband's got this, or my husband's got this, or my boyfriend. I finally hired somebody to start seeing men. We go through andropause, all right? Women go through menopause, we go through andropause,
Okay,
all right?
Talk about that.
When we're not making adequate hormone. And so many men are deficient in testosterone. We see young men, we see guys in their 20s.
Yes.
Something is insulting their body, something inflammatory in their system is preventing them from making proper amounts of testosterone.
Yeah.
So out of being a nice guy, I said, yeah, we'll see a couple of guys, we'll bring them in. And we brought in a nurse practitioner, and probably 35 to 40% of the practice now are men.
Wow.
Just balancing their hormones.
My goodness.
Because we go through the same thing, but obviously most of the time we blame it on you.
Yeah.
But we do go through the same things you do.
Yeah. And you know, it isn't just the emotional that usually when we talk about menopause, we talk about the emotional, because it's often linked to the time when the kids grow up and the empty nest, all those changes, but also it's physiological. And I think something we don't talk enough about is bone loss, directly linked to hormones.
Well, and you'll see a 50% reduction in bone fracture in women who utilize hormone therapy. So why are we not utilizing it? Why are we not utilizing testosterone in women? All right. It's not FDA approved anywhere to use testosterone in women. We use it for hyposexual desire, okay? We're not using it for the real reasons. So these are hormones that are deficient, that are causing specific problems. And part of treating that inflammation that it's causing is balancing the hormones. So whether you're a male, have your hormones looked at. You know, if you're a female, definitely have your hormones looked at, because we can safely replace those.
And a lot of women, I know from my own friends who know I'm taking bioidentical hormones, they're concerned about the testosterone. They're concerned they're going to start growing hair on their face. I don't have hair on my face. They're concerned about, you know, starting to develop male traits. And I suppose if they had the wrong amount of testosterone, those things could happen. But it's all about seeing a professional.
Let's talk about that, because I think that's critical. When women hear testosterone, they think of oily skin, acne, hair growth. That's why I think it's so important to visit your physician. Check levels, balance levels, and you get on hormones, and then you determine, hey, is this enough? Caution your patients that, hey, oily skin, acne, hair loss, those are not normal. If you see anything like that, because I don't know what your level of sensitivity is.
Yeah.
All right, until
We're
I
all
know
unique.
that, we don't want those problems to occur. So no, it's not going to occur if we start low and gradually go up with the hormone therapy.
And the process, it'd be interesting to talk about that, because I remember when I first came to you, we had a long conversation. You were very, very generous with your time. And then there was a lot of labs that had to get done.
Right.
And that's the science of it, right? And you're looking at those labs and you're determining from that what are the right levels of estrogen, of progesterone, of testosterone, the things that need to be replaced based on that woman's individual. This is not a pill that's sitting on a shelf.
It's not a one size fits all for no one.
Absolutely.
And that's the beauty of the bioidentical hormones. We can put together a hormone for you, for him, for her. They're all different. It's what your body is needing. I had a patient recently call me, and she was on hormone therapy, and her husband passed away. And she didn't want that libido anymore. And it was very easy. We talked, we lowered her. I want her to still have testosterone for the benefits, but we lowered it enough that she wasn't going to have that libido when she didn't want it. So that's the benefit, that we can tailor it to your needs, not one pill, one size fits all. It doesn't work like that.
And you stay in touch with the patient, right? I mean, so I come and see you on a regular basis. And actually, I think now we're down to twice a year, and come in, and if retesting is necessary, you retest. For me, it hasn't been necessary because I feel very balanced. And again, my issue was sleep, and I'm sleeping like a baby. So
I check levels more often probably than I might need to, but if someone comes in with a complaint, definitely I want to know, are you absorbing it? You may not be absorbing it, or the receptors in your body are overfilled now, and we have to look at an alternative way. So if you come in with a complaint, we're going to look at the levels and change things for you. So, but I really want to stress the importance of visiting your doctors and talking about hormones. Don't convict hormones from the WHI study. It was a bad, very biased study that has no sense in today's medicine, because we have a different woman today. We have a woman that wants to look good, feel good, that wants to be out in the real world, running major businesses. When you don't sleep, or you break out in a hot flash in the middle of a meeting,
it's not good.
Or you're suffering with female intimate problems from lack of estrogen, urinary incontinence, problems like that. And you're right in the middle of a business meeting. So these are things we need to talk about. Talk to our patients. Don't just give them an antidepressant, or say, yeah, it's okay to drink 4 glasses of wine before dinner and take that sugar in. And but that's what we hear. We hear that every day.
Let's talk about that, because I have a very strong bias feeling that Americans are so over-medicated in so many areas, right? Things that if we would just shift our diets and lifestyle, we would be able to get off of most of these medications that we're on. But of course, the pharmaceutical companies have a big influence on the docs that they call on, and even in medical schools. So when we look at how traditional medicine is treating many of these women, please talk about that. What are the common ways that we're seeing in antidepressants, et cetera? Would you talk about that?
When a woman comes in and they're in their, late 30s, early 40s, and they may have some irritability, or PMS is worsening, or they have no libido. Libido is a big topic now, and it should be. It's part of the relationship. But women feel left behind. So when they come in, I think it's important at whatever age, check levels. We don't know when testosterone is deficient. Okay? We don't know, like estrogen, we can test it. You may be deficient and be 26 years old and need testosterone, and we have patients like that. If the level is low and they're symptomatic, let's treat them. I feel very comfortable and safe treating that person. But then again, those are the people that we watch their levels along the way so that we don't give anything excess. So again, bioidentical hormones, the natural way to do it, to be able to customize a hormone for a patient, is probably the best way you can balance hormones and reduce inflammation for them, along with lifestyle changes, less alcohol, stress management, and sleep.
Yeah. Brilliant. You said it all. If you were to say 3 more things that our viewers could apply to their lives today, what would you say to the man or the woman that's listening today that says, gosh, I never thought about the role that hormones may be playing in my health? What would you say maybe the top 3 things that they should think about maybe making a change that they could do immediately?
I think number one, lifestyle changes are important. I think we need to, monitor our dietary intake. Look at what we're eating. I mean, we eat junk. You go to the grocery store. When I was a kid, my mom would cook stew all day on the pot, on the oven.
Yeah.
And now you go to the store and you get stew in a box and you put water in it and heat it up.
Yeah.
How is that healthy?
Right.
So, look at what you're eating, change your diet, exercise, stress management, I think is so important. I preach that. I live highly stressed, but when I can take the time, I do feel better.
Yeah.
So I think those are the big keys to take away from this. Managing hormones, visit your doctor. Don't jump on antidepressants and anti-anxieties for problems that you're having. Seek the underlying cause.
Perfect.
And have that treated.
Dr. Mirabile, thank you so much for being with us today.
You're welcome. Thank you for having me. Thank you.